So this is Kathy Matias-Riggs and Nicole Pernick, and Kathy's going to do some cranial work on Nicole after her TBI. This is the fourth session. Kathy's going to explain what she's feeling and how she's treating Nicole. Go ahead, Kathy.
Okay. So the last time I worked with Nicole was on March 17th. And this is about 2 weeks ago. And at the time, her cranium presented with a left side bending rotation of the spheno-basilar symphysis, along with a left lateral strain pattern, some compression of the SBS, and her symptoms included difficulty controlling her jaw, difficulty with her peripheral vision, difficulty swallowing. And so what I'm going to do now is reassess her head through osteopathic functional manual medicine methodology and evaluation. So the first thing I'm going to do is try and feel for her CRI, which is the cranial rhythmic impulse, and see how healthy that is. Got a rate of about 12 expansion contractions per minute with a moderately low amplitude of all 4 quadrants. Slightly higher in the right posterior quadrant. Using the vault hold, I'm going to assess her range of motion of the SBS. Her cranium still presents with a left lateral strain, however, this is reduced from 2 weeks ago. The left side bending rotation is no longer there. I do sense a little bit of a left torsion that wasn't there before. So we will start with that. And for treatment, I'm going to use an indirect action method. Nicole, how was your vision right before we started this? Any deficits or anything to note?
Well, because we just did all these eye exercises, my eyes were pretty good. But now I definitely have better vision to the lower half of the ceiling than I did before.
Okay.
Now you can see the different colors, shades of white. the left eye works better. And now the left eye is lubricating. Or it feels chilly.
Now I'm going to stack the strain pattern and add the left lateral strain.
Pelvic floor activation.
Very good. So with the left lateral strain, what I find is that the left frontal bone is a little more anterior. The left maxilla is a little more anterior than the right. And if we look at her ear position, the left earlobe is slightly more anterior than the right. So let's address the compression. I'm taking her spheno-basilar symphysis into a little bit of extension before I decompress using a direct action method. And if there are any notable changes, Nicole, go ahead and let us know.
Increase in saliva. Better airway passage in my nostrils. And now I can see out the window behind you for the first time. Or maybe my eyes can just go up now, I'm not sure.
She has a moderate degree of compression of the SBS, so it's taking some time to decompress.
Feel something right here.
What is that?
Like a pulling.
Okay.
Like a pulling right here.
Okay. And now let's
It was a light pulling, but just
yeah. I'm going to assess for any frontosphenoidal joint restriction, particularly on the right side of either the greater or lesser wing. And I sense restriction in the lesser wing. So let's work on that. Jenny, may I have a glove?
Yes.
Just one, thank you. I just didn't want to unhook
Medium,
the.
okay?
Yeah, I just didn't want to unhook the
Yep. No, you're good.
mic.
Are you going in?
Or no?
I am. Is that okay?
Yeah.
All right.
Just one? Do you need anything else?
No. Actually, maybe the pillow.
The pillow?
Yeah. Thank you. Okay, don't raise your head. Yes. Okay. Keep your head there. Okay. So what I'm going to do is stabilize her sphenoid intraorally so that it doesn't move. And then I'm going to just gently disengage the lesser wing of the sphenoid from, or I'm sorry, the lesser, oh my God, I'm having the frontal bone from the lesser wing of the sphenoid, I'm sorry. Okay. Okay. Here we go. So I take her sphenoid into as much flexion as possible with my left little finger on the pterygoid plate. The left hand holds the sphenoid in flexion, while the right hand disengages the right frontosphenoidal joint. Thank you.
Mm-hmm.
Okay, Nicole, pull your toes up toward your face. Good. Take a deep breath in. And slowly exhale. And you're going to do it 2 more times. Okay, breathe normally, relax your feet. Okay.
That was a good one.
How was it good?
It just relieved a lot of pressure around my eye sockets, which was nice. And on the second breath, I had pelvic floor activation. And anytime I have pelvic floor activation, it's a blessing.
And what is your activation? What do you
So like
mean by
pelvic
that?
floor muscles pull up, like
Oh.
on their own,
Okay.
right? So just, yeah.
All right, so let's reassess the presence of her left lateral strain. Still a little bit anterior
Definitely feels more even.
and a little bit anterior on the maxilla, but we can work on that right now with some balancing of the maxilla and the zygoma. I'll balance the maxilla or the zygoma first. So we know that the zygomae externally and internally rotate. Left one is in an external rotation, the right one is in internal rotation. There's a little bit of tissue and muscle tightness on this side. Do you sense that at all?
Mm-hmm.
Here
Mm-hmm.
versus here.
Is it supposed to feel like the left one?
Yes.
Oh.
What are you sensing?
I always thought the left one was just like atrophied and weak, like in general, the left. I do feel it.
Okay. Balancing of the maxilla using the mustache technique. Okay, resolving. Let's go now to the cerebellar falx and assess the tension at the tentorium. Are you doing okay? Swallowing wise? Okay.
Swallowing's great. My ears are popping sometimes. I'm not sure if it's popping or if it's something. I just hear something happening.
So I'm just providing a little bit of cephalid traction to the RCPM on both sides. Just slightly tighter on the left than the right, but much improved from the initial visit, which was about a month ago?
3 weeks, maybe a month.
Yeah, about a month, almost a month.
Yeah, almost a month.
Yeah. Good. Now I'm advancing up to the falx cerebri, assessing for neural tension of the dura mater. A little tighter on the right. Starting treatment.
This is increasing blood flow to my left kidney, which is extremely specific. But I felt the referral, pattern first, and then when you started treatment, I felt like the pulse, which is kind of cool. I have a lot of issues with my left kidney.
Now let's balance the temporale. Okay. Better, better. Okay, we'll do a little myofascial-mandibular balancing. Did Jenny do this today?
No.
No, okay.
Feel tension right here.
Okay. Are you okay with this?
Hmm?
It's a lot of pressure. The side's a little thicker on the right, but not as pronounced as initially. Okay. Good. And then advancing to the digastric muscles on both sides, but the anterior portions, the suprahyoid area. And we know your digastrics assist with swallowing because they control your hyoid. There we go. Are you okay with this?
Hmm?
Does it hurt?
Hmm.
All right. Again, a lot of pressure, just waiting for a release.
Did it release?
Mm-hmm.
Oh yeah, I can swallow way better. It's lower.
What's lower?
My swallow,
Yeah.
it's not so high
Oh,
up.
up, yeah.
It's like nice and down.
Okay. So now I'm reassessing the amplitude of the CRI, which is improved on both sides with expansion. Okay. Do you want to slowly sit up? And just relax for a minute. Are you okay?
Yes.
All right. Any differences or changes from when we started?
So my eye gaze turns with my head. Like, that makes sense? Like my eyes go with my head?
It's synchronized?
Yes.
What happened before? If you turn your head, your eyes don't go with it?
Right, like I'd probably look down if I turn my head and then look up, or my eyes would stay that way and then it would have to they would lag.
Oh, it's like you're spotting.
Yeah.
Okay.
And now everything's just moved together.
Okay.
And I guess I don't have to turn my head as much.
Okay.
Because I can see where I'm going.
Right. You're not separating your eye and your head motion, so
right.
it's like it.
So otherwise you're turning your head blind. You don't really know what you're looking for.
Right.
And then my pelvic floor, or my, I guess, lumbar and cervical spine stack better. I can feel it in my sit bones. I can feel my sit bones when I'm sitting.
Okay.
Normally I have a hard time sitting on anything, and I can feel my sit bones right away and just evenly stacked.
Okay.
So it is, and my diaphragm expands evenly. So definitely just centered.
Okay.
And
All right.
balanced. And calm.
Thank you.